Here in the US, podiatrists are doctors who use their overarching knowledge of different specialties that they've learned after 4 years of podiatry school and 3 years of residency, such as biomechanics, dermatology, sports medicine, and orthopedic surgery. Today I'm just going to go over 8 different specialties that a podiatrist will use every day in their practice. First, surgery. During your 3 years of residency training, almost every podiatrist becomes certified to be a foot and ankle surgeon. Because of this, podiatrists are able to perform surgical procedures in order to fix various foot and ankle problems, such as foot and ankle fractures, Charcot-Marie tooth disease, club foot, Achilles tendon trauma, avascular necrosis of bones and joints, neuromas, bunions, acute ankle conditions, and many, many other issues. They are also able to do total ankle joint replacements, different joint fusions, rejoin tendons, amputate parts of the lower limb due to issues such as diabetes, and lots of other complicated surgeries. Number 2, radiology. Of course, if a podiatrist is dealing with maladies of bones and joints, they're going to have to be very familiar with how to take radiographs of their patients. By the end of the week, a podiatrist will literally have taken hundreds of x-rays and MRIs of their patients. Number 3, dermatology. Podiatrists have the knowledge to treat all kinds of dermatological issues with the lower extremity, and can even do a fellowship after their residency to specialize solely on below-the-knee dermatology in their practices. With this knowledge, a podiatrist has the ability to diagnose and treat infections of the foot and ankle, such as dermatitis, diabetic ulcers, skin cancers, fungus, xeroses, and all kinds of other diseases found below the knee. 4, wound care. Wound care involves taking care of wounds that are physiologically impaired and are not healing. As a wound care specialist, you are treating chronic and acute wounds by conducting wound debridement, prescribing antibiotics, doing topical therapy, closing the wound, and even putting on skin grafts. Number 5, podiatric orthopedics. Podiatric orthopedics is a treatment of imperfect foot and leg structure and function through the use of special footwear, orthotic and prosthetic devices, and even physical therapy. Number 6, podiatric primary care. Podiatric primary care is the prevention, diagnosis, and treatment of podiatric conditions related to the total family healthcare environment. These are podiatrists' bread and butter of the general foot care. These involve toenail trimming, getting rid of calluses, performing injections, and of course, cutting out ingrown toenails. Number 7, there's also podiatric sports medicine. This one is awesome and one of people's favorites to learn about. Podiatric sports medicine obviously involves primarily working with athletes. Most professional athletic teams will have a team podiatrist. So if you were an athlete, or you still are an athlete, and you enjoy working with athletes, and this sounds fun to you, then this is an obvious option that you can use in the podiatric field. Number 8, which is last and definitely not least, podopediatrics. Podopediatrics is a podiatrist who works specifically with children and teenagers. If children and teenagers are the age range that you would love to work with, then this is definitely an avenue for you. These are just some of the specialties that a podiatrist will use every day in practice. If you'd like to learn more about the field of podiatry in the US, please check out some of our other videos.